Welcome back to the Lars Larson Show. It's a pleasure to be with you, and I fully admit that I'm a fanboy when it comes to Taiwan. I was born there, yes, so I have a bias in that sense, but I'm also a fan of Taiwan and how they have handled the China virus, because the China virus has devastated a lot of countries. Even its origin, China, took a tremendous hit from it. But one little country right there, 80 miles away from communist mainland China, the freedom-loving people of the Republic of China, which is Taiwan, they've handled it amazingly. As I saw the latest numbers, fewer than 500 cases in a population of 24 million, and less than a dozen people have died from the China virus. And I've suggested this is the example that the rest of the world, including the United States, should have followed. Dr. Kevin Pham joins me now. We call on Dr. Pham a lot. He's a visiting policy analyst at the Heritage Foundation. Doc, welcome back to the program.
Glad to be back. Thanks for having me.
Let's get some of the nuts and bolts out of the way. First of all, other than almost universal mask wear that you cite in your list of things that Taiwan did, and strict quarantining of incoming visitors and free rapid testing, did Taiwan shut down its economy the way much of the United States was, I guess, felt compelled to do?
Don't believe they shut down quite as tightly as we ended up doing it here in a lot of places here. But as you mentioned, it's really because they were able to implement all of these other things. And so we in America kind of followed this really broad, really blanketed approach. We kind of just firebombed the entire economy trying to cut this thing down. But the Taiwanese approach was if we're worried about our freedoms, what the Taiwanese did was they quarantined people very aggressively. They had this electronic fence system that they created, which was not optional. Anybody who was found to be who tested positive, they couldn't leave their houses because their phones would be tracked for location. Yep. And you couldn't get around this by like leaving it at home or turning it off, because there would be random inspections as if we were still in high school or something like that. They would call, and if you don't answer the phone, you could incur a law enforcement action, which is a bit much for something that we would do here in America.
And up to a $5,000 fine, right? I mean, it was pretty heavy, but did they get voluntary compliance for most people, or did they actually have to zap people with a fine?
I think the threat of enforcement activity would have compelled enough compliance that they didn't really need to do so. But one woman, she complained about this because she was sleeping when they called her and she didn't pick up, and then she was threatened with that huge fine, which is pretty onerous if you ask me.
Well, so she had to prove that she was sleeping. Now, I'm not sure we would have accepted that, but if we had gone to nearly universal mask wear, we had a lot of public health authorities, including ones at the national level, back in January and February, telling what I called out as a lie at the time. They said, oh, masks really don't make that much difference. And later they said, well, we admit we were lying. We were trying to preserve the supply for medical personnel. But if we had gone fairly quickly to almost universal mask wear voluntarily, could we have achieved the same result without the massive damage to the economy that we've seen?
I do think that we would have mitigated a lot of the spread if we had all started masking up early on, especially in places like Seattle, New York City, San Francisco, and LA. If those really dense areas had more masking earlier, we would have prevented a lot of this.
Okay, can we still get there? I mean, we're late in the game. The numbers are ramping up amazingly. And I mean not in a good way, amazingly. Is it too late to try to adopt some of that same thing? Universal mask wear, not by dictate, but by voluntary compliance. If you say, folks, we can get back to a somewhat normal situation, but we've got to do some of these things that have actually worked in this one good example, because I'm not picking some little teeny town somewhere in the world saying, well, it worked well there. This is a tiny country. I think it's 13,000 square miles with 24 million people in it. It's a fairly dense population, and yet they got almost universal mask wear. And was there a legal consequence for not wearing masks, or was it done mostly voluntarily or through social pressure?
It was done mostly voluntarily. They just in Asia in general, there's a much greater acceptance of using masks. It's almost a normal part of life, especially during the pandemic season, because every single year when we have the influenza outbreaks, it starts off in mainland China and then it spreads throughout the world. And Taiwan being right there, they get it fairly frequently. So they're used to more disease prevention measures, just like washing your hands, hand sanitizer usage, and masks. I think we can get to a point where we start to mitigate this again. I think we're in a spike and not a prolonged climb, because the country had been in the process of reopening since May. A lot of different states, some states slower, some states faster, but we had been reopening in some levels since May, and we didn't get this uptick in cases until mid-June. So that tells me that we can go about this, we can be responsible about this and do okay. It's just June was not a very normal month, so we can get back to that place.
The other thing that surprised me, because Dr. Pham, again, I'm fascinated by the country. I mean, some of my, my attraction to the country is I was born there. I think it's an interesting place. It's also a freedom-loving people. I admire their attitude. I admire their capitalism, especially when they got mainland China constantly threatening them to send missiles, to hurt them, to, take them over again, to treat them like Hong Kong. But one of the other things that jumped out at me, Doc, early on, back in January, I already had a bunch of these masks, these N95s, because I use them in my shop when I'm using power tools and stuff that's going to generate a lot of dust or, paint, stuff like that. And I bought some more. But I noticed that in Taiwan, they were churning out masks 11 or 12 million a day, and they were selling them for the U.S. equivalent of 17 cents a piece. If masks were like that, 17 cents a piece, you'd probably get people adopting them a lot more quickly than when they're $2 or $3 a piece.
Certainly, and not only did they ramp up mask production tremendously, but they also implemented a rationing system. So certain people could only buy masks on certain days, which ensured that there was a lot of supply, or at least there was sufficient supply for everybody. And that's one of the things that we did not see here was not just the lack of rationing, which, that's another issue altogether, but people who could get masks started hoarding them. And then we had all these stories where people were hoarding supplies, trying to I forget what the word is, but resell them for profit. And that's not really conducive to a functioning society.
Scalp. And in fact, I saw that the government itself said, the mask companies can only make 2 or 3 million a day, which is amazing. They went out and bought machines that'll churn out 100,000 masks a day, and the government bought 60 of them. So that's like, you can churn out, 6 million masks a day. It's an amazing accomplishment. And the government did it. And then when the private company said we don't have enough people, they said, fine, we'll take the Taiwan Defense Forces and we'll send them down. It would have been the equivalent of the U.S. saying, put the National Guard to work running those mask machines, and we'll churn out millions of them a day. If Taiwan can very quickly go from 2 million, 2.5 million masks a day to 20 million masks a day, do you think a country like the United States shouldn't be capable of doing much more?
We should be capable, but we are a much larger country, and a lot of the supply chain issues are going to be exacerbated because we have very large distances for supplies to have to travel. So there's a bunch of other things too. So I would cut a little bit of slack here. But yeah, no, certainly we should be. A country like the United States should be producing enough masks that everyone should be able to get them, and not just the frontline workers who need them, but everyone else should be able to buy them at this point.
Well, do you see many other countries actually looking at Taiwan saying that's the way to do it and actually following the suggestion?
I don't see that too much, and part of that is because just the global consensus right now, a lot of it is really biased against Taiwan because, the Global Health Authority, the World Health Organization, is really siding with the mainland China at this point, and so there's a little difficulty for people trying to pay attention to really what's going on in Taiwan. Taiwan's have been trying to warn the world about this since the very beginning.
Absolutely right. Dr. Pham, I've got to break away, but thank you very much for coming on. That's Dr. Kevin Pham from the Heritage Foundation. Coming up, now one U.S. senator wants to out federal law enforcement officers and put them at greater risk of coming under attack. We'll talk about it next.